Hey everyone, welcome back for another deep dive. Today we're going to really get into a topic that I know you're all familiar with, but maybe we can uncover something new about glass ionomer restorations.
Absolutely. I think even the most seasoned dental physician can always learn a little something more about GICs.
Yeah, I think you're right. To keep things engaging, we're going to be using a classic dental textbook as our guide for this one.
Sounds good to me.
You know, it's funny, even though GICs are a pretty fundamental part of dentistry, I'm always struck by that chemical bond they create.
Oh, yeah, for sure. With both the enamel and dentin, right.
Exactly.
Yeah.
It's not just like those other materials that rely on mechanical retention. What kind of advantages have you found that gives you in practice?
Well, I think the big one is micro leakage, right?
Right.
That strong bond really helps minimize it. You get a tight seal at the margin, so you have less chance of recurrent decay and less post-op sensitivity for patients.
Yeah, no one wants to deal with that.
Absolutely not, no.
And then, of course, there's the fluoride release, which is always a good thing.
Oh, yeah, big plus. It's like a built-in caries prevention system.
Totally. It's almost like a slow-release fluoride treatment happening right there at the restoration.
Yeah, exactly. Especially for patients who are high risk for caries,
Definitely.
like xerostomia or history of recurrent decay.
Absolutely.
Yeah.
Okay, so we've touched on some advantages, but maybe we should step back a sec. For anyone who might need a quick refresher, what's actually in this glass ionomer cement? What makes it tick?
Well, at its heart, it's really a pretty basic combo. Powder and liquid.
Okay.
The powder's made of finely ground glass, silica, alumina, and calcium fluoride. And then the liquid, that's usually polyacrylic acid.
Oh, right. So that acts as like an activator.
Exactly. It gets a setting reaction going.
Okay, that makes sense. Now, I vaguely remember back in dental school, there were all these different types of glass ionomer cements,
Uh,
each with their own specific use. Could you walk us through those classifications again?
Oh, absolutely. The most common system breaks them down into three main types. Type I, Type 2, and Type 3.
Okay.
Type I, that's your luting cement, ideal for permanently cementing crowns, bridges, inlays.
Gotcha. So if I was placing a zirconia crown, for example, type I would be my go-to.
Exactly. They have a lower powder-to-liquid ratio, which gives them a really thin film thickness and excellent flow properties.
Okay, makes sense. What about type 2?
Type 2 is your workhorse for direct restorations.
Okay.
Higher powder-to-liquid ratios. That makes them stronger and more wear-resistant. Good for those class 3 and V restorations, places where aesthetics are important.
So like those anterior restorations where you're really trying to match the natural tooth color.
Precisely. Now, type 3, that one's a bit more of a multitasker.
Okay.
It can be used for lining or basing, depending on the consistency.
Oh, interesting.
Yeah, so the ones with less powder, they're flowable. You'd use those for lining cavities before placing the final restoration.
Got it.
But the ones with more powder, they make a really strong base for restorations that need that extra support.
So type 1 is for luting, type 2 restorations, and type 3 liner or a base. That's pretty straightforward.
Exactly.
But wait, I think there's another classification system too, right?
Oh, you're thinking of Mout's classification.
Yes, that's the one.
That one breaks it down even further.
Right, into more specific application.
Exactly.
Yeah.
So, for example, within type 2, you've got aesthetic and reinforced subtypes.
Okay.
Aesthetic GICs are great for, like we said, those anterior restorations where appearance is key. But reinforced GICs, those have added metal particles.
Oh, interesting.
They're tougher, much better suited for areas with higher chewing forces.
Is that where we get into those miracle mixtures I've heard about?
That's the one.
Okay, so tell me, what makes them so miraculous?
Well, miracle mixture is kind of a casual term, but it really captures the excitement around these metal reinforced GICs.
Oh.
They tackle one of the big concerns with traditional GICs, their lower fracture resistance and wear.
Yeah, compared to some other materials.
Right, but by adding silver alloy or cermet particles, you get this big boost in strength and durability.
Yeah.
They can actually handle the stress in those areas with more occlusal force.
So adding metal seems kind of counterintuitive, but it ends up solving a major problem.
Exactly.
So we have our luting cements, restorative cements, and now these reinforced versions for extra strength.
Right.
GICs are starting to seem a lot more versatile than I initially thought.
Oh, absolutely. And that's just the beginning. We haven't even talked about resin-modified GICs
Oh, right.
or Giomers.
Right.
Those combine the best of both worlds. GICs and composite resins. They offer better aesthetics, handling, and even faster setting times.
Okay, now you've really got me curious.
Yeah.
Let's talk about those advanced variations. I'm especially intrigued by gyomers. What makes them so unique? Gyomers.
Yeah.
They sound so futuristic. What is it that makes them so special?
You could say that. Geomers, which stands for glass ionomer cement resin systems, are like a hybrid. You're getting the best of both worlds, GICs and composite resins.
So we're talking the chemical adhesion and fluoride release of GICs, but with the strength and aesthetics of composites. That sounds pretty amazing.
It is. And it's not just like mixing the two together. The chemistry is really quite sophisticated.
Oh, I bet.
Yeah. They use these special pre-reacted glass ionomer particles. They're called PRG fillers.
PRG fillers, okay.
And those PRG fillers, they release fluoride and bond chemically to the tooth structure, just like traditional GICs. But when you add the resin components, you also get the strength, the polishability, and the aesthetics of composites.
That's incredible. I'm starting to see why everyone's so excited about geomers. But there are different kinds, right? Not a one-size-fits-all kind of thing.
You're right. There are some key distinctions within the geomer family.
Mm.
We have SPRG geomers. Those are highly aesthetic, and you often use them in similar situations to composite resins, particularly for anterior restorations. And then you have FPRG geomers. Those are more focused on fluoride release, and they can be used for things like dentin bonding agents, pit and fissure sealants, or restorations for cervical lesions.
I'm a little confused about the difference between the SPRG and FPRG. Can you explain that a bit more? And how does that choice actually affect my patients?
Sure. So the S in SPRG stands for surface pre-reacted glass.
Okay,
These geomers have a higher concentration of PRG fillers on the surface of the material,
gotcha.
which enhances their aesthetic qualities, making them perfect for visible areas where blending with the natural tooth color is really important, like anterior restorations or class V lesions on premolars.
So SPRG joiners are the choice when aesthetics are your top priority.
Exactly. Now the FPRG, that stands for fully pre-reacted glass.
Okay.
These geomers have PRG fillers distributed throughout the entire material, meaning they have a higher overall fluoride release,
I see.
which makes them great for applications where caries prevention is the main concern.
So if I have a patient who's at high risk for caries and I'm doing a cervical restoration, I might choose an FPRG genomer for that extra protection.
Exactly. Like an extra shield against those acid attacks.
This is fascinating. We've gone from simple luting cements to these high-tech geomers with aesthetics, strength, and fluoride release. It's amazing how far GIC technology has come.
It really is impressive. And the innovation isn't stopping there. Scientists are always looking for new ways to make GICs even better. Things like nanoparticles, bioactive glasses, even amino acid modifications are being explored to improve their properties.
Nanoparticles,
Yeah.
bioactive glasses. That sounds like something out of science fiction. What kind of benefits do those modifications have?
Well, for instance, with nanoparticles, you can actually engineer them to release therapeutic agents, like antibacterial or remineralizing agents, right at the restoration site.
Wow.
This targeted delivery could revolutionize how we deal with caries and promote long-term oral health.
So we could have GICs that not only restore the tooth structure, but also fight bacteria and help remineralize the tooth.
Exactly. It's a very exciting area of research. And then there's bioactive glasses, which have been showing a lot of promise in other areas of medicine, like bone regeneration. Imagine incorporating that into GICs. It could potentially stimulate the regeneration of dentin, taking restorative dentistry to a whole new level.
Dentin regeneration. That's almost too good to be true, like something you'd see in a movie.
I know, right? It sounds crazy. But the research is looking promising. Bioactive glasses can interact with the surrounding tissues and actually encourage cells to be active.
Incredible.
It's still early, but the idea that GICs could help regrow lost tooth structure, that's amazing.
It really is mind-blowing when you think about it. Like,
Yeah.
GICs are no longer just filling a hole. They're actually becoming active participants in the tooth's healing process.
That's a great way to put it. And that's what makes this area of research so fascinating. GICs are constantly changing, always pushing the boundaries of what we can do in restorative dentistry.
It is inspiring to see this kind of innovation. But I imagine there are still some challenges that researchers are working on. What kind of hurdles are there to making GICs even better?
One of the ongoing challenges is improving their mechanical properties.
Okay.
We've made a lot of progress with metal reinforcement and incorporating resin components. That's really helped with their strength and wear resistance. But, GICs still aren't as strong as some other materials, especially in high-stress areas like posterior teeth.
So for those molars that take the brunt of the chewing force, we might still need to use other materials like amalgam or composite resins.
In many cases, yes. But, research is constantly